This is Dr. Veena and I welcome you all to my YouTube channel, Dr. Veena, your homeopath. Well, today's topic which we will be discussing is about Blatta Orientalis. Well friends, Blatta Orientalis, the common name of it is Indian cockroach. Well, it sounds little gross, but I tell you it is very effective medicine which is clinically used. Well, let me tell you how this medicine came into use. Its drug proving, was accidental. What happened was, there was this man who was suffering from asthma from many years. For many years he was suffering. So he was not getting relief from any medicines. So one fine evening, as usual, he was drinking his tea, and after completing his tea, he found that he felt, better, he felt little relieved, and then he thought, what was it in, tea? Whether because of this tea he felt better or what? So he called his housemaid and asked, did you put something in this tea? And the housemaid said, no, nothing was, added. And then he again, tried to inspect, and he found that there was cockroach inside the tea. Again, it is very gross. But he told his homeopathic friend of his that this happened. So this was complete accidental proving, and it led to this medicine, Blatta Orientalis. Well, there is one more Blatta, that is called Blatta Americana, and Blatta Americana is from cockroach, American cockroach. So this is Indian cockroach, American cockroach. Blatta Americana is used in jaundice and edema, so don't confuse with this. Now let's see clinically where it is used. The sphere of action of this remedy is specifically towards lungs, my dear friends. And as that man, he was suffering from asthma, and his asthma got better, so hence Blatta Orientalis also was used to give medicine to asthmatic patient, and asthma was found better, it was relieved, it was cured, it was very effective. Now what happened in asthma is an inflammatory condition. There is inflammation of the air passages. When we inspire air, the air goes inside our windpipe, that is trachea, and trachea is divided into two bronchi, and then the smaller branches, bronchioles, and then alveolar sac. Now in asthma, due to inflammation, what happens is the passage becomes more narrower, and when the passage is more narrower, obviously the air, inspiration will be difficult. The air, will not go properly inside towards the last, air's spaces. So it will be constricted, narrowed, and similarly due to inflammation there will be secretion. So what happened basically in asthmatic patient, the person, there will be difficulty in breathing in as well as outside. It will be very difficult for him. Shortness of breath will be there. There will be coughing because sputum is there, secretions are there inside this air passages, so sputum will be developed. There will be a lot of cough, and especially nocturnal cough will be there when he will be lying due to gravity force. Secretion will be gravitate towards downwards, and again he will be very difficult. Then again, he has to move here and there. So things like that. So in asthmatic patients, Blatta is a very good remedy. So we can use there. We can use in chronic bronchitis, COPD cases. We can use in pneumonia. We can use in cases where respiratory system is defective. So next friends, let's talk about when, where, how to use. What potency it is to be taken. Now Blatta Orientalis, remember, is a very good and effective when it is taken in lower potencies, especially like if you ask me, I use it in mother tincture forms. So when a patient comes to us and he's having this breathlessness, asthma or any respiratory condition where it is very acute cases, please try to give in lower potencies. In boric also it is written, give lower potencies in the time of spasms. When there is acute exacerbation, give lower potency. Mother tinctures has to be given. And then when the symptoms feel, the patient will say it is getting better and better, that time increase the potency. Means higher potency you give. You give in 6C, you can give in 30C or 200 potency, 1M potency. And then when the symptoms are better, don't repeat it, because if you repeat, there will be aggravation of the symptoms. In boric, there is also one line, when arsenic album is indicated but is insufficient. Means when a patient comes, we take the case analysis, and then in case analysis we find, yes, arsenic album is the medicine for asthma. Well, there are so many medicine, not only arsenic album, you can give calicarb according to the symptoms, there is ipecac is there, and so many remedies, heparsal, xylella, anything. So when you give these medicines, polycrest remedy or according to individualization, and still it is somewhere insufficient, still cough is not going, the acute condition is there, exacerbation is there, there is the use of Blatta Orientalis. Try to give mother tincture first, but once the symptoms are better, then do not repeat it. So my dear friends, let's conclude that yes, the name is little gross, but its importance is too high that we cannot avoid this medicine. So this was all about Blatta Orientalis. Hopefully it is knowledgeable to you, and if it is so, please like and subscribe my channel. Till then, goodbye and thank you.